How does autonomic dysreflexia cause hypertensive crisis? Have you ever wondered how a condition like autonomic dysreflexia can lead to a dangerous spike in blood pressure? This is a critical topic, especially for those who have spinal cord injuries. Autonomic dysreflexia is a serious condition that often affects individuals with injuries at or above the 6th thoracic spinal level. When triggered, it can cause a sudden and severe increase in blood pressure, known as a hypertensive crisis. So, how does this happen? It all starts when a stimulus occurs below the level of the spinal injury. This could be something as simple as pain, a full bladder, or even tight clothing. These triggers provoke an exaggerated response from the sympathetic nervous system. Normally, the brain sends signals to regulate blood pressure, but in someone with a spinal cord injury, those signals cannot reach below the injury site. As a result, the body experiences widespread vasoconstriction, which is the narrowing of blood vessels. This leads to a rapid and significant rise in blood pressure in the arteries. The body tries to counter this increase through baroreceptors, which are sensors that detect pressure changes. These sensors are located in the carotid sinus and aortic arch. They typically trigger a response to lower blood pressure by slowing the heart rate and dilating blood vessels above the injury. However, because of the spinal injury, these signals cannot effectively reach below the lesion. This creates a mismatch in the body. Above the injury, you might see symptoms like flushing and nasal congestion, while below the injury, the skin can appear pale and cool due to the ongoing vasoconstriction. Clinically, this condition can lead to severe headaches, sweating above the injury, blurred vision, and goosebumps. If left untreated, a hypertensive crisis can result in serious complications, such as seizures, strokes, heart attacks, or retinal detachment. From the perspective of hypertension, autonomic dysreflexia represents a unique form of crisis. It is not driven by primary cardiovascular disease but rather by an uncontrolled surge in sympathetic activity. The episodic hypertension seen in autonomic dysreflexia is caused by this imbalance, where the sympathetic response cannot be adequately balanced by parasympathetic inhibition due to the spinal cord disruption. In practical terms, managing this condition involves identifying and removing the triggering stimulus. For example, emptying a full bladder or loosening tight clothing can help. If necessary, antihypertensive medications may be used to quickly lower blood pressure. Understanding how autonomic dysreflexia works is essential in emergency situations related to hypertension. Prompt recognition and management can prevent severe cardiovascular and neurological damage.